to the platform Swiss Liver Patients Association, Swiss HEPA. Today with the presentation of Professor Andrea de Gottardi, Head of Gastroenterology and Hepatology at the Ticino Cantonal Hospitals, about the topic Wilson's disease or Cooper storage disease. Welcome, Professor de Gottardi.
Thank you very much for the invitation. My task today is to give an overview about Wilson's disease. Wilson's disease concerns mainly the brain and the liver. It's an old disease described in 1912 for the first time, and it has a special relationship to copper. What does copper do? Why it is important? Copper is important because it has a role in a number of crucial functions of our organism. It is involved in the control and in the production of red blood cells. It contributes to the regulation of heart rate and blood pressure. Moreover, it is involved in the development and maintenance of bone, connective tissues, and organs such as the brain and the heart. And we will see how important it is, especially for the brain. And it activates the immune system. And you understand that it is, in this particular case, very important to tightly regulate how copper is uptaken in the organism and how copper it is excreted from the organism. And to do so, there are very complex mechanisms that are in particular regulated by a protein that is called ATP7B. What is that? You can see this protein in the center of a liver cell, here as an example. And in Wilson's disease, there is a genetic mutation that changes the function of ATP7B. This protein is responsible on one hand for the excretion of copper. He is down in the direction of the bile canaliculus, so for the excretion of copper, so the elimination of copper into the bile. But this protein is also responsible for the integration of copper into ceruloplasmin here in the upper part of the slide. And ceruloplasmin is necessary for the transport of copper. You see that there are many other proteins and factors involved in the regulation of copper, but today the focus is on ATP7B, and we know that there is not only one single mutation, but there are more than 700 mutations that are known to be related to Wilson's disease. And then when one of these mutations occurs, then there is an accumulation of copper in locations that are not ready to uptake that quantities of copper. The incidence of Wilson's disease is approximately 1 out of 30,000 persons. Particularly in Sardinia, the prevalence, the incidence is much higher, 1 in 7,000. Once copper accumulates in the organism, there are special particular symptoms called primary symptoms and potential secondary symptoms. And I will start with the liver here on the left side. Copper accumulation can be associated with an asymptomatic elevation of liver enzymes, for example, ALT and AST, but also with acute hepatitis and acute liver failure in some particular cases. And when the disease turns to be chronic, then patients can develop cirrhosis that is compensated in the absence of complications and decompensated in the presence of complications of cirrhosis. Another important organ is the eye, and we will see in the next slide, but the eye is characterized by the development of so-called Kaiser-Fleischer rings. And these are typical of Wilson's disease. And then very importantly, the nervous system is involved, in particular the central nervous system, so the brain. And when there is a copper overload in the brain, movement disorders can develop with speech disturbances, gait and balance disturbances, for example, but also personality disorders, mood disorders, or a cognitive impairment. And last but not least, as I mentioned before, copper is also important for the formation of red blood cells. And copper accumulation, Wilson's disease, is characterized by acute hemolytic anemia. It's a disease in which red blood cells are excessively fragile, and when they are broken, they produce hemolytic anemia. And there are other potential secondary symptoms related to glucose or calcium metabolism or disorder of growth. As I mentioned before, also the cardiovascular system may be affected, and the kidney may develop some forms of dysfunctions that I'm not going to detail now. But you see, it's a systemic disease. And the symptoms that we can see, or the signs, are, as I mentioned before, the Kaiser-Fleischer ring. More of 50% of the patients develop them, and 95% of patients have also neurologic symptoms. You see on the left side a normal eye, in the center a beginning Kaiser-Fleischer, and on the right side a very developed Kaiser-Fleischer ring. But patients can also develop muscular cramps or neurological disorders that include shaking of hands, swallowing or speaking problems, and depression. And you see here an example of muscular contractions or problems with the central neurology with the brain. And these symptoms may be worsened with therapy, at least for a certain time. And I will touch on these points later on. In the liver, Wilson's disease is very difficult to recognize unless we use special stainings. You see on the left side biopsy, where you can very nicely recognize the cells of the liver. And in the center of the cells, there are nuclei. There are blue-violet, and these nuclei are normal. But in some cases, there is a small white inclusion. And this is called glycogen or glycogenated nucleus. And this is suggesting or compatible with the presence of Wilson's disease. And another feature is also the presence of a fatty liver. And you see these vesicles, white vesicles, are much bigger than glycogenated nuclei. And these are or correspond to the accumulation of triglycerides. To be more precise, there are special stainings. And you see here on the left side ornithine, and on the right side rhodamine. And when these stainings, spatial staining, show accumulation, this is compatible with the presence of an excessive quantity of copper in the liver. What test can we use to assess whether or not there is an accumulation of copper in the body? The first and most frequent test is serum ceruloplasmin. It must be decreased, and there might be false positive or false negative, but is the easiest and first test. If ceruloplasmin is lower than expected, then we proceed to a special quantification of urinary copper in 24 hours. And if the amount of copper in the urine of 24 hours is excessive, then this is compatible with the presence of Wilson disease. The measurement of serum-free copper is a possibility, but we don't do it in our routine. To be more precise, we measure hepatic copper, and for this we need, and this is the clear disadvantage, liver biopsy, and we can take a fraction of this liver biopsy and send for copper quantification. And as I was mentioning before, we can identify Kaiser-Fleischer rings in or during clinical visits. Interestingly, these patients present a decrease in red blood cells, which is called anemia, and an increase in liver function tests, ALT or AST, but another liver function test called alkaline phosphatase is decreased. And this is in contrast with almost all liver diseases where serum alkaline phosphatase is also increased. So in Wilson's disease, it is typically decreased. And this makes the diagnosis somehow easier. And we have here a so-called Leipzig score, and this is used to evaluate or assess the probability of having Wilson's disease. It takes into account the presence of Kaiser-Fleischer rings, the presence of neurological symptoms, the quantity of ceruloplasmin in the serum, the presence of anemia, the liver copper, as I was mentioning before, the urinary copper, and there is also the possibility of a mutation analysis. But remember that, as I was mentioning before, there are more than 700 mutations, so it's quite complicated. But according to this score, you can speak about an established diagnosis if we have more than 4 points, a possible diagnosis when you have 3 points, or a very unlikely diagnosis here if you have 2 points or less than 2 points. Once we have the diagnosis, it is important to treat this disease because it is a treatable disease. The first line treatment used to be penicillamine, and it is more and more also replaced by trientine. Both penicillamine and trientine are drugs that bind to copper, and these drugs are then eliminated with the urine mainly. Both treatments are very effective, and penicillamine tends to present a higher rate of adverse events. I will come back later on to these events. And trientine is a little bit more expensive. And besides penicillamine and trientine, we have also zinc. And zinc is used for the maintenance treatment, is very effective when there is a moderate accumulation of copper, and it has very few side effects. If we go more precisely in the treatment, you see that we can use penicillamine. It is known with the name methyl-captase. The problems that I was mentioning are bone marrow problems. So bone marrow is not producing white cells and red cells as it should do. There might be renal problems, there might be skin problems, and normally penicillamine should be administered together with pyridoxine. There is a second possibility, as I was mentioning before. This is trientine. Trientine is available under the trade name of Triogen or Cuprio in Switzerland. It can also be responsible for skin problems or also for digestive problems and nausea. And we have zinc, for example, Bogenstein gluconate is one form that we can use. If Wilson's disease is confirmed that we have maintenance therapy, and we adjust this therapy according to the quantity of copper that is excreted in the urine. If there is an established Wilson's disease with liver disease and or neuropsychiatric symptoms, then we have a treatment dose therapy. That is, we start with a small quantity, we increase until the dose that is necessary to empty the overaccumulation of copper, and then we switch to maintenance therapy. In case, and these are very rare cases, of Wilson's disease manifesting in the form of acute liver failure, the only treatment is liver transplantation. I would like to mention also the possibility that Wilson's disease develops and manifests during pregnancy or for patients, female patients with Wilson's disease that are pregnant. It is important to continue the treatment, because stopping the treatment may be very, very dangerous, particularly during pregnancy. This is one point. And the other point is concerns breastfeeding. So please do not breastfeed when taking these drugs. And do not stop treatment to breastfeed, because this can be dangerous for the mother and for the baby. But it is important to go on with the treatment. So what I would like you to take home as a message from this short presentation is that Wilson's disease is a problem with copper, is a disease where copper is accumulated in the body. The main symptoms include liver and brain, and there is a treatment with chelators, penicillamine and trientine, and with zinc, and this treatment works. So this is important to know, because this is a treatable disease. And with this, I thank you very much for your attention. If you have any questions or comments, you can contact me at the email address that is shown in the lower part of this slide. So thank you very much for your attention.
Thank you very much for the instructive and exciting presentation, Professor de Gottardi, and your great personal commitment. Thank you very much.